Hospitalizations, a really important number. It's a 3-day number, but it's worth noting that our current hospitalizations of 436 is, I think, the lowest it's been in over a month, and I think that's something worth noting. Fatalities still high at single digits per day. I hope to see that number go down as you've seen hospitalizations go down over the last week or so. So I'm really happy that the positivity rate's going down in our entire region. I'm really happy that our region, the Northeast, is the leader when it comes to vaccinations. I think the top 6 states in the country when it comes to vaccinations per capita are in the Northeast. We have now 66%, 2/3 of our adults defined as 18 and above, who've now been vaccinated. And if you assume that we got 2/3 who've had at least their first shot, and you also have some who have already been infected, probably carrying some immunity as well, we're getting in much better shape, closer to herd immunity, whatever that means. I know it means big stuff when it comes to our seniors over 65. If we all did as well as our seniors, 90%. You've heard me boast about this age group before, but we were worried, 50% of people were vaccine hesitant. I'm not sure if I want to get vaccinated. You heard that a few months ago with some frequency. Well, 90% have been vaccinated, 65 and above, and they continue to get vaccinated. You'll see that in a minute. More sites are accepting walk-ups. We're going to have 50 locations in 26 cities and towns across the state where you can just walk up and get yourself a vaccination. You want to find out where that mobile van's going to be? Go to ct.gov/COVID-vaccine/walk-up. You see that they've lifted the pause on J&J. So in those towns where you have, say, 2 facilities, one may have J&J, the other may have the mRNA, which is Moderna and Pfizer. So just to give you a little context, I think we're going to have a big anti-vaccination rally here tomorrow. Maybe we should bring one of those mobile vans there just if anybody changes their mind. This next chart, I think, is interesting. This is the daily first dose volumes by age group. A couple of things. You can see it goes back a couple of weeks where the vaccination number of vaccinations per day peaked. It so happens that it was 2 weeks ago that we also put the pause on J&J. I think there are a lot of reasons that the vaccination hesitancy is. You see 30% fewer people getting vaccinated here in Connecticut today, or rolling average compared to a week or 2 ago and 2 weeks ago. A couple of things. I mean, I'm interested that the 75-year-olds, that's the purple line at the very bottom, they've been able to be vaccinated the longest. They continue to get vaccinated, 1,000 a day or so. 65 to 74, that light blue number. So you'll see that there's continuing vaccinations across the board. 16 to 17 is the third, the lowest, and then I won't bore you anymore with this, but I thought it was interesting that that's the highest increase in people getting vaccinated. We're making a big effort in the younger demographics because that's where we still have the most people who are unvaccinated. So shout out to the 16 to 17-year-olds. And I'll tell you one way we're able to do it. Susan and I happened to be at the Rensselaer Field, the mass vaccination center, Pratt and Whitney this morning. You'll see me there with a bunch of the kids. These are different vaccine incentives. We're doing everything we can to incent people to get vaccinated. So now that we're running into a little bit of lethargy or a little bit of hesitancy. So for the kids, we call it the Ferris Bueller Day Off Vaccination Incentive. And all the kids from the greater Hartford area, high school age, got some time off. And there they were getting vaccinated. We vaccinated over 1,000 high schoolers there. We're going to continue this as we go around the state. So we're going to be there. We want you to take advantage of this. Other incentives, you see, I wouldn't call this an incentive, but the EU, Europe has said, look, if you want to come visit us this summer, you have to show that you've been vaccinated. not sure I want to go to Italy or France right now, just given the high positivity rate, but it's interesting that people are being pretty strict there about showing you've been vaccinated or you're not allowed to come. Sort of interested, the Dodgers and the Oakland Athletics and the other California teams, the Angels, they're going to debut fully vaccinated seating at their baseball stadiums, which are outdoors. So they have outdoor seating, vaccinated only in those areas. It's like the Easy Pass line, a faster lane in, better seating. These are some of the incentives you see as you look around the country. Well, we've come up with one of our own, and it's called, have a little fun here, Connecticut Drinks on Us. And you show your vaccination card, you show that you've been vaccinated, and starting on May 19th, we have hundreds of restaurants that are going to participate. You come on in, you get something to eat, you get a free drink. Could be a lemonade, could be cool Frosty, probably not their high-priced champagne, but we're doing everything we can to give you an incentive so that you know that if you've been vaccinated, come on in. That's going to be true of thousands of restaurants across the state, bars across the state, and we'll be rolling that out and doing a lot of publicity around this. All you got to do is go to ctvisit.com/drinksonus. And to have a little bit of fun here, starting May 19th, that's the day that we open everything up. That's when you'll have be able to get a drink outside. That's when the bars, et cetera, are going inside. And it's also a day that you'll be able to get a free drink, provided you can show that you've been vaccinated. You got a few weeks to think about it. Don't let this go to waste, young people. All right, so Melissa McCaw has been a testimony machine over the last 5 days. And in addition to providing testimony about our budget, also today we rolled out in a formal way our Connecticut recovery plan, the rescue plan. You know that the federal government has given us significant money, about $6.3 billion over the next 2 and 3 years to be invested to make an enormous difference in people's lives as we continue to work our way through on the backside of COVID, I believe, get people back to work and healing. And there's sort of several priorities as we've walked this through with legislative leaders, walked it through more broadly. It now goes before the legislature for their consideration. One, last of the vaccination programs we need to make sure everybody gets vaccinated and we break the back of COVID once and for all. Secondly, investing in our future, creating a more affordable Connecticut. That's everything from free childcare, free summer camps, scholarships, making this more affordable. Economic growth that works for all. A major investment fund with a real focus on distressed communities, a real focus on Black and brown citizens who maybe haven't had access to capital. Here's their opportunity to start up a business and hit the ground running. And modernizing state government with the necessary investments in IT so we can do for the rest of the state government what we're able to do for Department of Motor Vehicles, make it easier for you to take care of the services you need at a lot less hassle. This next chart just sort of summarizes what I was describing before. Early childhood, again, big expansion of daycare and child care in the history of the state. K through 12 education, not only do we have the free camps coming on board in early July, but also a number of wraparound services going forward. Let me say, when it comes to the free summer camps and the such, it's time for the municipalities to step up. We're putting up enough money to take care of 24,000 kids this summer. The municipalities and the superintendents of schools have their own significant allocations from the federal government. So we urge you to come in and match us there. So instead of taking care of 24,000 kids this summer, we could take care of 72,000 kids this summer. And what an enormous difference that would make. And while I'm at it, this has now been formally presented to the legislature for their consideration. Timeliness is important because we have, a college-age youth corps that we want to start hiring folks so they can help out in the camps and help out as mentors for these kids. Summer programs for the kids, a lot of their parents are beginning to make up their minds now. So the sooner we can give them a clear indication of how we're going to proceed, and there I need legislative buy-in, the sooner it is that we can start bringing these young people on board, either as counselors or as kids at the camp themselves. Children and adult mental health, rolling out mobile vans to do everything we can to make sure kids heal and are back going again. Criminal justice, really important. We're going to have significant resources for public defenders and prosecutors, do everything we can to help our court system get going again. Legal aid, especially for those who perhaps have some problems with their landlords, we got resources there. The Economic Action Plan, I gave you a teaser on that before, and they, as well as workforce development, we're going to provide free certificate programs at our community colleges. We're working with the business sector. Where do you need people? Who are you ready to hire? Who can't you find trained personnel for? Sometimes it's in IT, often it's in the trades, working with the labor unions. Often it's in healthcare. We're going to put together a certificate program that helps you get that job. We're providing that through our workforce development efforts at no cost to you. And Beth By, our Commissioner of Early Childhood, is providing free child care, daycare. So here, take this opportunity during this summer where you got a little time. If you're looking for a job, we got 150,000 people looking for a job. We're going to train you for an even better job. And finally, housing. We have significant money in there for housing, in particular rent relief. And Sayla's working on that, so you'll have outreach there. Look, that's just a quick bullseye of what we're trying to do. And I want to make sure that this is money coupled with our $22 billion budget. If you put that together as a package to show that we are taking care of the people most in need, really with a focus on equity and make sure that those who have been left behind get them a running head start and get our state moving again. And Melissa is here to answer questions as well as Josh and Paul.
Fox 61.
Hi, Governor. You talked a little bit about the mobile vaccination sites, but could you also talk about the community health center announcing that they're also going to be doing no appointment vaccination clinics at some of the biggest locations around the state?
We're going to roll this out statewide. We're going to have more and more no appointment walk-up opportunities, including what the federally qualified health centers and health clinics are doing. Josh, you want to add to that?
No, that's exactly right. The CHC announcement is part of a larger announcement the governor just made. And anyone who's interested in a walk-up appointment, go to ct.gov/COVID-vaccine/walkup. And you'll see dozens of sites all around. And as the governor's mentioned before, we also encourage people to follow your local health department or your local mayor for selectmen. They're very active about sharing out on social media the appointments and clinics that are closest to you. But basically, it's never been easier to get vaccinated right now. There's walk-up appointments around the state, same day, next day appointments. So really encourage everyone to go out there and get their vaccine if they haven't yet.
And then with the incentive that you mentioned, Governor, with the drinks, it's really interesting. I think a lot of people will find that exciting to hear about. Can you talk a little bit about how you guys created that, working with certain restaurants and that sort of partnership?
Yeah, David Lamont and I were talking about this. David reached out to the Restaurant Association. They've been great partners throughout this entire pandemic. We've now, they're open, and it's good in terms of we're trying to get people back in the restaurants. They feel comfortable outside, inside. And we said, look, we're going to be promoting this far and wide. If you help with the free drinks, we'll get more people back. Provided you're vaccinated.
NBC Connecticut.
Good afternoon, Governor Matt Austin with NBC Connecticut. Just following up about the mass vaccination sites, how quickly do you think the state won't need them any longer?
I think, Matt, you're going to find that, Look, for a while, we can do like we did at Rensselaer, bring the school buses in, vaccinate 1,000 kids a day there. See, as long as we can do that would be very positive. But my hunch is over the next couple weeks, you're going to find community health centers and our other partners targeting more and more local groups as opposed to big mass. You know, we're talking about the fairs, maybe parades, maybe beach sites, places where people are congregating. You'll be able to get vaccinated there.
And just in terms of the vaccination numbers from the past few days, does that include any Johnson & Johnson vaccinations? And has the state received an update from the federal government about when additional supplies of the J&J vaccine will arrive? I can tell you, so far we haven't administered any J&J. That's just beginning to start now. That's been a sort of a 2-week pause. I think Josh said we got about 140,000 doses right now ready to go. So I think supply won't be an issue for a while when it comes to J&J. And then just finally, tomorrow, President Biden is expected to roll back some of the outdoor mask mandate. Is Connecticut anticipating to do the same?
I think we are. We're either already there or we'll go alongside what they're saying. Look, when you're outside, you can keep a little distance. You've been vaccinated. You know, we're relaxing the mask mandate when it comes to that. No necessity. If you're in a more crowded group, even if you're outside, you don't quite know who they are, we'd probably recommend you wear the mask a little bit longer.
And that's just for vaccinated people?
That's certainly for vaccinated people, and I think we'll listen to what the CDC says, but I think it's going to extend to unvaccinated as well, outdoors.
Okay, thank you.
Channel 3 Eyewitness News.
Governor, with the vaccine demand dropping, what percentage of our doses are getting discarded right now?
Do you know that, Josh?
It's still a very low percentage. Our providers have done a fantastic job of, carefully budgeting their day to only open the vials that they expect to be able to use. But we have provided some guidance to providers that as we get deeper into the program here and supply exceeds demand, that they should not let that wastage policy get in the way of making sure they vaccinate every single person that they can.
And Governor, my final question, and this is more of a medical one. People may see the daily positivity rate today at, 2.82, and then use that as a personal excuse not to get vaccinated. So if our vaccination rates stay under that target of 70%, from a medical perspective, what could we be looking at?
Well, I'd take that argument and turn it on its head, Matt. I would say I see 2.82%. It is working. The vaccine is working. My grandparents, my parents are a lot safer. I'm younger. Maybe a third of my friends have been vaccinated, but 2/3 haven't. And this is my opportunity to show you it's effective and it works. Go get vaccinated. I hope it inspires people to get vaccinated, not makes you complacent.
Thank you very much.
News 12 Connecticut. News 8.
Governor, this weekend the CDC updated their guidelines for camps. How important is it to get them open and get them out there as far ahead of time as possible so parents can make plans?
I think it's very important. I mean, these camps are going to be key to getting our kids back in the game soon after the July 4th break. They're outdoors, they're socializing, a little educational component, a little playful component. We're going to provide, significant subsidies are free so that nobody's discouraged by price from being able to take advantage of this. And so we got to get that, make that clear to our camps now so they can start planning accordingly.
And from children to seniors, what about opening up senior centers more? I know, what advice would you give that as some people have been shut in for quite a while?
I think it's appropriate now. I hadn't really focused on it, but let's face it, 90% of the seniors are vaccinated. If you want to say, as somebody who manages the senior center, I'd like only vaccinated people to come back. Come back. A lot of our seniors, like their great-grandchildren, have been alone for a long time. It's time for them to be with their friends. I think you can do it safely now.
WTIC 1080 News.
Hi, who's paying for the drinks? Drinks on us? Is that the state? Is that the restaurants themselves? Somebody's got to pick that up.
Oh, that's right. The restaurants are chipping that in, Dave, which is really good. Very generous, really important, a great incentive to get vaccinated. And we, the state, are going to help promote this far and wide, like I'm trying to do today.
Somebody will wonder if there's a price range there. Is that's going to be set by restaurants themselves?
Well, the price for the drink is free. I think they'll determine exactly which of the beverages included there. We'll leave that up to the restaurant.
All right. And when you opened up vaccinations to 16 plus, you mentioned the hospitals holding special clinics for those with various serious conditions. Do you have an update on that? How'd that go?
I don't know about that, Josh. Do you?
Yeah, it was well received. We got a lot of good feedback on that. But, I think we got through that rush, a couple weeks ago now. So certainly if there's anyone still, was concerned about, the surge back on April 1st when we opened up to the final phase, wanted to wait till it calmed down a little bit. This is just another reminder that this would be a great time to go out and get vaccinated. Very easy to find an appointment across the state right now.
Connecticut Public Media.
Good afternoon. Wondering what other details you can offer on parents on the efforts to send kids to camp for free this summer.
Other details in the camps? Well, we're certainly going to have that posted on our site. We'll be able to tell you all the camps that are signed up. Melissa can help me with this, but we're sending out an RFP right now. They're going to submit their proposals. They'll tell us, whether they've got municipal buy-in. They'll say whether the local superintendent of schools. Melissa McCall, do you want to add to that?
Yes, Governor, that's spot on. So the Department of Education will lead the process whereby various camps can submit an application for consideration to provide supports to kids who need camp programming. As a part of that application process, we are encouraging the camps to seek participation of either the local municipality that has their own separate funding source or the school district to match the number of slots for the kids they're seeking to serve. Ideally, we really want to see, for the partnership with the state, a match from the local municipality and the district so we can serve more kids. So more to come on that. There'll be an announcement that will come from the governor's office, and we'll provide more information for the camps to submit their applications and the time frame in which they'll be considered. Obviously, we want to give parents some certainty or some clarity on what opportunities we have for the summer, so we'll be looking to move expeditiously.
Thank you. And Governor, any thoughts on the latest findings by the U.S. Census?
I just got those numbers. We grew 0.9%. We're going to do a lot better in the next decade. I guarantee you that. At least we're keeping all our congressional districts intact.
The Associated Press.
Hi, good afternoon, Governor. I know that some of the money that's coming from the federal government, the plans you have for it is time sensitive. So do you have a timetable at which you need the legislature to act on certain things in your plan, and what would that be?
Sooner the better. But Paul, do you want to be a little more specific?
Yeah, I would say obviously we, based upon the legislation they passed, it calls for them to take up the plan and be presented to the Appropriations Committee and then eventually to the full legislature for approval. As you see from this very comprehensive plan, particularly when it comes to summer camps, those parents out there know that it's better to know now than to know later, so they can be able to plan accordingly and make those decisions on behalf of their children. On top of that, we also have for our early childhood providers who are looking to get that certainty. So as the governor stated, while we put forth a very comprehensive plan and the legislature will go through their process, process. It is our hope that we can have this done sooner than later.
And is it something that you can take parts of this out that need to be done right now and some of the more contentious items maybe wait for later, or does this all have to be passed as a package?
It would be, first of all, I would say, I don't think there's anything in here that would be considered as contentious, first and foremost. So the governor has presented a full comprehensive package that was put together and led by Secretary McCall, myself, and Commissioner/COO Josh Jabal, with all of our relevant commissioners who came together. It just showed really the real grace and the overall leadership of this administration led by this governor. But we see that this is a full comprehensive plan, and we don't really see it to be broken apart. Obviously, a part of that plan, the $2.6 billion, it takes into account funding that will have to be attributed to the state budget as a whole. And what we're basically presenting to the legislature is a full comprehensive plan that we hope that they take up and consider in due time.
Okay. And as Johnson & Johnson comes back online, are people going to have choice? Are they going to know when they sign up for a vaccine or go to one of these walk-ups whether they're getting Johnson & Johnson or something else? Because obviously there are some people much more hesitant to take the Johnson & Johnson than the others.
Yeah, they'll have their choice. You'll be able to go online and look up what van has which particular vaccine. Absolutely.
Thank you.
The Hartford Current.
Hi, everybody. On the Johnson & Johnson doses, do you guys know yet where they will be allocated? You had said before the pause it would be specifically to mobile vans and colleges. Is that still the case?
Josh?
Well, there were other uses that were underway when the pause went into effect as well, Alex. But right now, most of our providers are assessing demand and where they'd like to redeploy the Johnson & Johnson inventory that they have right now. What we'd expect to see is resuming use, offering Johnson & Johnson to emergency department discharges. That was a use that many of our hospitals were embracing right before the pause. We have some of the small pharmacies around the state have already started to administer J&J again. And we are looking at the mobile units. We had gotten some initial feedback that we should stick with the mRNA vaccines. But what we're going to try to do is, particularly like in a city where we have multiple mobile units going at the same time, have at least one of those in the city offering Johnson & Johnson, so that, like the governor said, if someone has a preference, they prefer one or the other, that those options are available. So, we'll see, as the governor mentioned, clearly labeled either in the registration process or on social media or on the walk-up clinics which vaccine is being offered. We do know that there's a lot of people who've been waiting for the pause to be lifted because they do like that one and done aspect of J&J. So we're hopeful that we'll see that demand pick right back up.
What was the reason for the feedback that some people wanted mRNA vaccines at the mobile clinics?
Well, I think we all saw the press on the pause. I think, oftentimes people kind of overread the relative risks. So there was a little bit of initial apprehension. I think it'll take some time to see how that plays out. And we just want to make sure that multiple choices are available. All choices for the different vaccines are available to anyone who wants to get one.
Do you still think it makes sense to use Johnson & Johnson for college students?
Well, as of this week, we will have completed first dose clinics to every Connecticut college and university using one of the mRNA vaccines, Pfizer or Moderna. So certainly if a college student didn't participate in one of those clinics, they'll have every opportunity, of course, to get a Johnson & Johnson vaccine in Connecticut before the school year is out. So they'll have choice as well.
Got it. And then finally, I just wanted to check in on vaccination in congregate settings. Is that complete? Is that still in progress? What about sort of the various state-run facilities?
Well, I know vaccine has been offered to every a resident of a congregate facility run by the state of Connecticut, whether that's our correctional facilities or our the Department of Mental Health and Addiction Service facilities or our DDS facilities. So that is complete. And many of the other congregate facilities, as you know, nursing homes has been complete for months now. But we're shifting now to kind of maintenance mode, right? Because these populations all turn over. People come and go, and we want to make sure that we stay on top of that and make sure that vaccines being offered to every new admission coming into the process.
Thank you.
Hearst, Connecticut Media.
Governor, you mentioned the anti-vaccination rally that will happen tomorrow amid the House vote on the religious exemption bill. How big of a threat do you see the anti-vaccination population here in Connecticut to the state's efforts to reach herd immunity?
I think that people here in Connecticut broadly understand that the vaccinations in our state and around this country have been incredibly safe, incredibly effective. FDA, if anything, has erred on the side of caution all along the way, certainly when it came to J&J. So I'd like to think that whatever the protest may be, it doesn't discourage people from going out and getting vaccinated.
You mentioned sending a mobile van there. Is that something you're seriously considering, or are there other kind of ideas that you're thinking about to try to reach this population, which we know is difficult to reach with, just education alone?
I'm just going to continue outreach. No mobile vans. I was just joking. But we're going to continue outreach, do everything we can to convince them it's the right thing to do for their family.
And then just wanted to confirm, so there are providers now with the pause being lifted administering J&J, and when did they start that? Yesterday, or?
Have they started at all?
I think just a few of the smaller independent pharmacies have started today, perhaps yesterday, but just getting started. Yeah, most of the providers are still assessing how they're going to roll it back out.
And the supply stands at about 140,000, is that correct?
Yeah, 136,000 when we started the day in Connecticut right now, and that was held over from when the pause went into effect.
Thanks.
The Connecticut Mirror.
Hey everyone, just wanted to come back to a question on the mobile units. DPH sent out a memo to vaccine providers at the end of last week saying that the units would continue with the mRNA vaccines for the, quote, foreseeable future. Do you know roughly when those mobile units will begin using J&J again?
Yeah, Jen, as I mentioned, the providers are in the process of assessing, when and where to bring J&J back out into those mobile units, and those discussions are ongoing. So, we'll likely start to see some more J&J in those mobile units in the coming days.
And I know you mentioned earlier some concerns that were raised about it. Is that sort of the reason why it's being delayed, rolling these back out through those mobile units?
Listen, we just want to have the vaccine in front of people that they're most comfortable receiving, whichever one that may be, to lower and eliminate any barrier that could be out there for someone to get vaccinated. So our goal is to provide choice and easy access for everyone in Connecticut. And, we think providing all three options is helpful in that regard.
Thanks.
CT News Junkie.
Thanks, Max. Governor, your Demas commissioner sounds like is leaving to work for the federal government. Any idea who's going to be taking over there, or when we can expect an announcement on that?
Well, fortunately, Miriam's going to be with us a while longer because it had to go through a appointment process and then a confirmation process. And Josh, are you paying attention to the rest of the team there?
Of course. We have a strong team there, but as the governor said, we're so happy for Miriam and proud, but she will be continuing to lead the department for a number of weeks longer, and we'll have more announcements as we get closer to our confirmation.
Okay. The legislature's redistricting committee got to work today. There's a bill before the legislature that would change how prison inmates are counted, whether or not they're counted in the town where the prison's at or the town where they came from. I wonder, Governor, I don't think I've heard you weigh in on that issue, where you stand on that bill.
Well, I think we'll leave this up to the commission, but my instinct is those who are incarcerated ought to have the right to vote from where they're from, or give them that choice.
Okay, thank you.
The Waterbury Republican American.
Thanks. In terms of the mobile vans, I guess the Griffin vans, how many are being deployed at the moment?
We will be at 35 by this weekend. I don't know what the to-the-minute count is, but we're ramping up to 35 by early May.
and the second FEMA unit is here as well?
I do not believe that's here yet, Paul, but I'll double check on that.
Okay. In terms of having this sort of menu of vaccines, if available, do you think that will help in your quest to sort of, I guess, get more people vaccinated? As we sort of, I know there's concerns expressed last week after reaching 51 or so percent fully vaccinated that getting to community immunity will be a little more difficult. Getting people to get convincing people to get vaccinated. So do you think having a choice will help with that in that regard?
I think so, Paul. I mean, I want to take away any reason for hesitancy there might be. So now you have a choice. Some people think the mRNA is incredibly effective, more effective. I want Pfizer. I'm a Pfizer guy. Other people have said previously, J&J was becoming very popular because it's simple, one shot. So now you've got some flexibility out there. We can customize the vaccine depending on whatever your wishes are.
Okay. And have we received any indication about how much J&J will be, or when J&J deliveries will resume? I think providers were advised that they could start ordering again this week.
Do you know that, Josh?
Yeah, we have. We believe there may be opportunities to start ordering more J&J next week. But as previously mentioned, we have a lot of inventory in the state already, so we won't be held back based on the supply there.
Sure. And Governor, getting back to your American Rescue Plan allocation recommendations, does this really boil down to in these upcoming negotiations with the legislature? It's basically the 1/3 of that funding that's not being used to offset revenue losses and help balance the next 2-year budget, correct? I mean, it's more about how we spend this approximately $900 million, as I think at least the Democrats are in agreement about using the other 2/3 for those other purposes.
I think that's right, Paul. Look, I was very happy to see, Speaker Matt Ritter and Vin Candelora on the Republican side both say, looks like we're headed in the right direction. Words that gave him some wiggle, but I hope we're going to be able to get some broad agreement on this pretty quickly.
Okay, thank you very much.
The Day of New London.
Right, I'm getting the signal here. I just wanted you to take a look at the group that got together down at Naugatuck Community College on Friday to roll out the Connecticut Recovery Plan. It's a subset of the commissioners who have been working around the clock over the last 13 plus months, and they'll tell me before that as well. I've had an opportunity in my life to work with some of the most extraordinary teams, but none better than the group I'm working here in Connecticut, especially under these trying circumstances. Unfortunately, President Biden is recognizing this as well. To my right is Charlene Russell Tucker. She's replaced Miguel Cardona. He was extraordinary. She's extraordinary. Hit the ground running. And as you heard, to the left there between Vanessa and David Lehman is Miriam Delphin-Rittman. She's been our incredible leader of DEMAS, Departmental Health and Addiction Services. As Josh reminds me, nothing has been more stressful. COVID has created the stress, what that's meant in terms of addiction, what that meant in terms of stress, what that meant in terms of mental health. And she is the coolest cucumber there is. And she's stepped up every day, doing everything she could, getting, therapy and love and counseling out to people where they need it. We wish her very well in the Biden administration. Thankfully, she's going to be here for another couple of months. And President Biden, leave the rest of our team alone for a while. We got a lot of work to do. Thanks, everybody.